Hello everyone, how are you all doing? In this today's video we'll be learning about reproductive health. So before going to this concept, let us understand what exactly the meaning of health. Okay, so according to WHO, which is World Health Organization, it has defined health as a state of physical, mental and social well-being. Okay, so now coming to the reproductive health, these many aspects have to be included under the study of reproductive health. Okay, so which is a overpopulation, knowledge of reproductive organs and STDs. So STDs refers to a sexually transmitted diseases. Okay, and then awareness about sex education, also birth control devices and prevention of sex abuse or sex related crimes and care of mother. Okay, so proper post delivery care has to be taken, right? So these are all the aspects which have to be included under this reproductive health. So now let us understand about this overpopulation. So what is the need for the control of this overpopulation, especially in India? So you know, right, India's population is growing exponentially day by day, isn't it? So if this trend keeps on increasing, for sure there will be a scarcity of food, right, proper housing, clothing and a proper medical care, also education. So all this scarcity will come for sure if the population of India, if it keeps on increasing like this, right? So there is a necessity to control the population, control this growing population. So it's a responsibility of each and every citizen of India or a couple to properly plan, right, to properly have a family planning in order to check this growing population, right? So this prevention or this check in population can be done by following or by adopting a birth control measures, right? And these birth control measures, what they'll do, these birth control measures will be doing, they will basically prevent the pregnancy, right? So this pregnancy can be prevented by not allowing the sperm to get fused with the ovum, right? In the other sense that we are trying to prevent the fertilization itself, correct? Yes, the fertilization can be prevented by adopting a birth control measures. Birth control measures. See, because every time or very often pregnancy is not good for a mother, so that's why it is better to prevent the pregnancy itself or a fertilization. So that can be done by adopting these birth control measures, or also called as family planning measures, or even we call it as a population control measures. So now let us discuss what are all these birth control measures. So now let us discuss about birth control measures. Okay, so these birth control measures can be broadly classified as barrier methods, chemical methods, IUDs, which means intrauterine contraceptive devices. Okay, and then we have a natural methods. Also there is another way, which is a surgical methods. Okay, so under this we have vasectomy and tubectomy, so we will discuss about that also later. Okay, so now let us discuss one by one. So now coming to the barrier methods. Barrier method, those are the physical structures which will prevent the entry of sperms inside a female reproductive tract, nothing but a vagina. Okay, so these basically prevent, okay, they will prevent the fertilization. Okay, see, in this we again have two types, like for a males we have condoms, and for females, okay, we have diaphragm and cervical caps. So these condoms are a rubber or a sheath kind of material which is put on top of a penis, okay, before copulation. So this will prevent the entry of semen or the sperms inside a female reproductive tract. Okay, so next, this diaphragm or the cervical caps are also similar to that. These physical structures are inserted inside the vagina, okay, so that the entry of sperms can be checked. Okay, so these both condoms, diaphragm and cervical caps, so these falls under a barrier method. They basically prevent what? Fertilization. Okay, yes, so if fertilization is prevented, which means the pregnancy is prevented, which means we are doing a birth control. Correct? Yes. So now coming to the chemical methods. The chemical methods includes the chemicals like foam tablets, jellies, creams, or paste like substances. Okay, and also spermicides. Okay, spermicides means the chemicals which will be killing the sperms. Okay, male gamete. So, and also oral pills also will come under these chemical methods. Okay, see these foam tablets, jellies, paste, creams, okay, or the spermicides, these are kept in the vagina. Okay, they are put in the vagina so that it will adhere to the mucous wall of it, and it will immobilize the sperms and it will kill them. Okay, so it will not allow the entered sperms to pass through the female reproductive part. Okay, it will kill those sperms there itself. Okay, so that is what these chemicals will be doing. Okay, but these oral pills, you can see, right, oral pills, so they are taken orally. So these are mainly made up of estrogen and progesterone hormones, which are taken orally to prevent the pregnancy. Okay, so these are consumed by the females in order to prevent the pregnancy. Okay, so these all will come under the chemical methods. Clear? Yes. So next is that we have IUCDs, which is nothing but a intrauterine contraceptive devices. So these devices, okay, will be kept inside the uterus. Okay, so these devices are kept inside the uterus and in order to check the implantation. So these basically these IUCDs will be preventing the implantation. You already know the meaning of implantation, right? In the previous video I have explained what exactly the implantation means, right? So it is the process in which the embryo or a growing embryo, nothing but a blastocyst, right, a mass of cells, it will come and get attached to the wall of uterus. That only we call it as implantation, right? Yes. So these IUCDs will basically prevent the implantation because they are kept inside the uterus itself, right? Yes. So under it, this is copper T, loop, spiral ring, all these things will be kept under the, will be kept inside the uterus. See, copper T will be something like this, okay, in the T shape, which is made up of a copper metal or sometimes a stainless steel also. So this is inserted inside a uterus, okay, by a practicing doctor or a skilled nurse. Okay, it can be kept for a duration of 5 years. Okay, so this basically what it does, it will prevent the implantation. So preventing implantation is again nothing but preventing pregnancy only, right? So it might fail to prevent the fertilization, but it will definitely prevent the implantation. Okay, so the loops or spiral rings can also be inserted and they can be kept inside the uterus in order to prevent this implantation. Okay, so this is all about these IUCDs. But these IUCDs, compared to the other methods, these are a bit risky. Because see, these IUCDs, as they have kept inside the uterus itself, they create discomfort in few women. Okay, and it happens sometimes unknowingly, it might come outside of this reproductive part itself. Okay, it might fall down, it might come through this vagina itself. Okay, and also it also creates bleeding sometimes. Okay, so these creates discomforts in many women, so that's why most preferably people won't go for this IUCDs. Okay, yes. So now coming to this natural methods. So in this natural method we have abstinence, rhythm method and coitus interruptus. Okay, so what is this abstinence? Abstinence basically refers to you avoid copulation itself. You don't intercourse, you don't undergo the sexual intercourse. Of course, there is no chance of getting pregnant, right? Yes. So the second is this rhythm method. So rhythm method, basically it is telling you that you go under a sexual intercourse only at a certain period. So if you remember, while explaining the menstrual cycle, I have told you the peak time of pregnancy, right? So if we consider the duration between 1 to 28 days, the 14th day will be the ovulation day, right? Which means on the 14th day egg will be released, correct? And the egg will live for about 1 or 2 days and then it will degrade, right? So only if copulation or the sexual intercourse happens during this time, which is 14th, 15th or 16th day, or just before 2 days, because the sperms can reside in the female tract for some more time, right? So then also there is a chance of getting fertilized, right? So that's why these 5 days, which is 12, 13, 14, 15 and 16. So these 5 days are called as the peak days of becoming pregnant. So this is a peak time of fertility also, you can tell, correct? So only if a couple will do a sexual intercourse in these 5 days, then there is a chance of a lady becoming pregnant, right? But if you avoid a copulation during this time, during this peak fertility time, then there is no chance of a lady becoming pregnant, right? So this only we call it as rhythm method, which tells you that to avoid a copulation during this peak time. You got it, right? Yes. So next is coitus interruptus. So coitus interruptus tells you that you just withdraw the penis before ejaculation during the sexual intercourse. Okay. So that's all about the natural methods, like without the use of the barrier methods or the chemical or IUDs. Okay. If you follow these natural methods, it will be the best, right? So because here you are not even undergoing a sexual intercourse, and coming to the rhythm method, you will not do the copulation during this peak time. Okay, so because here in these 5 days there is a very high chance of a lady becoming pregnant if they undergo a sexual intercourse. So if a couple are doing a family planning, then it is advised them to not to undergo a sexual intercourse during this time. Okay, so even if they undergo the sexual intercourse between 1 to 11th day or from 17th to 28th day, there is no chance of a lady becoming pregnant, because this is a infertile time, but this is a peak time of fertility, correct? Yes. So next is coitus interruptus. It is nothing but a withdrawal of the penis before ejaculation of a semen inside the female reproductive part, right? Yes. So that's all about natural methods. Now coming to a surgical methods, we have got 2 types here. So one is called as vasectomy and another one we call it as tubectomy. Okay, so now let us discuss about these 2 surgical methods in detail. Okay. Fine. So we have got 2 types of surgical methods. One is called as vasectomy, another one is tubectomy. Okay, so vasectomy is done in males and tubectomy is done in females. Okay, so what is this vasectomy? So this vasectomy is basically a small operation in which it involves the remove a small portion or cut of a vas deferens. Right, so what is this vas deferens? Well, explaining the male reproductive system, I had told, right, it is a tubular structure which connects the testes and urethra, correct? See, testes will be something like this, and the epididymis is there, and this is the vas deferens, right, which is a tubular structure which is arising from this testis, which will be connecting this testes and the urethra. The sperms which are produced in the testes will be reaching the urethra through this vas deferens only. So in vasectomy, what they do is they'll just cut the small portion of this vas deferens and they'll just tie the removed part with the help of thread like this. Okay, so thus what happens? The sperms, it prevents the sperms from reaching out from the testes to the urethra, right? So through the penis only it used to reach the female reproductive tract, right? So when this happens, when they have removed the small portion of it, there is no chance of sperm getting transferred to the urethra itself, right? So this is what they'll be doing in the vasectomy. So the same thing happens in the tubectomy. What happens? You are aware of it, right? In the way we have already studied about the female reproductive part. So from the ovary, there is something called as a fallopian tube, isn't it? So this fallopian tube will only receiving the egg, right? So the egg will be received by the finger-like projections called as villi, right? And it will be kept in this oviduct, isn't it? So now what they'll do is they will also do the same thing here as what they have done in the vas deferens. So they will also remove a small portion of it and they'll tie this backwards like this. Okay, so when they do this, what happens? What happens? The prevention of egg from reaching out to sperm can be prevented. So thus fertilization can be prevented, right? So these are the two surgical methods which are done in both males and females in order to prevent the pregnancy, okay, in females. That is nothing but this is one of the birth control measures. So understood, right? It is simple. In vasectomy, they are gonna cut the small portion of the vas deferens, and in tubectomy they are gonna cut the small portion of fallopian tube or a oviduct. So the name is coming fallopian tube as they are removing a small portion of it. So tubectomy, and vasectomy because they are removing a small portion of vas deferens. So clear? Yes. So along with these methods, we can also adopt few other methods in order to control the birth. Okay. So that is nothing but saying it is just by transferring the knowledge that people who are in their reproductive age, if they get to know the advantages of small families with the help of the social media, right, or the magazines, newspapers, like that, that will be helpful. They'll get to know the advantages of a small family and they'll also plan accordingly, isn't it? Yes. And next is that if we increase the marriage age, right, so that also improve the reproductive health in the females as well as in males, correct? So marriage ages should be increased, and in India you know already that it is 18 years for girls and 21 year for boys. So till they reach this age, they are not supposed to get married. Correct. So this also ensures that they will be having a good reproductive health. And also the contraceptive usage should be encouraged by the government by giving incentives and also facilities. Correct. So if they provide the incentives and the facilities, people will also, they will be so much enthusiastic in order to do or in order to follow these contraceptive methods in order to have a birth control. Correct. And next is that the social organizations should also involve themselves in initiating the programs, right, which will briefly explain the mankind about this birth control measures. Right. So this is all about birth control measures, the different types. Right? Well, so now let us understand about sexually transmitted diseases, which are also called as STDs. Okay. So before going to the examples, let us understand what are these STDs. See, sexually transmitted diseases are those diseases which are transferred by a sexual contact. Okay, which are transferred because of sexual contact from one person to another person. Okay, from an infected person to a healthy person. Okay, so when they undergo a sexual intercourse or a copulation, so these diseases will be transmitted. Okay, so they will be mainly targeting or they will be mainly affecting the reproductive part of a healthy person. Okay, so these are nothing but we call them as sexually transmitted diseases. Okay, so I have written few of the examples, very important and very known sexually transmitted diseases, which is nothing but the chlamydiasis, okay, and gonorrhea and syphilis, genital warts and AIDS. Okay, we'll discuss about AIDS in detail. Okay, so coming to this chlamydiasis, it is caused by a group of bacteria called as Chlamydia trachomatis, and gonorrhea is caused by a bacteria called as Diplococcus bacterium, and then syphilis is caused by a bacterium called as Spirochete bacterium. Okay, and genital warts, if you consider, so these genital warts and AIDS are because of virus, and this is because all these are because of bacterium. Okay, so there are different causative agents for these diseases also. Okay, yes, so genital warts is caused by HPV virus, which is human papilloma virus. Okay, remember it. And then AIDS. AIDS, what is the full form of AIDS? Yes, so they might ask you this in the exam. So AIDS stands for acquired immunodeficiency syndrome. Okay, and it is caused by a virus called as HIV, which is human immunodeficiency virus. Okay, so now let us understand about AIDS, okay, in detail, like what are the main modes of the transmission of this HIV virus, and how exactly it is going to weaken the human. Okay, so that and all we will study now about AIDS. Fine. The AIDS stands for acquired immunodeficiency syndrome. Okay, and it is caused by a virus called as HIV. Okay, HIV stands for human immunodeficiency virus. So this AIDS is a very fast spreading and incurable disease, right? So this basically targets on the immune system itself. Okay, it basically weakens a person's immune system. Okay, and this will be having a symptoms like a fever, lack of appetite, loss of weight, okay, and chronic diarrhea, and also tuberculosis, pneumonia, night sweats. Okay, see, HIV AIDS is not causing a single disease. Okay, it's not affecting your single part of your body or a single organ of your body. It's like a complete package of diseases you can consider, right? Because see, the HIV is basically weakening the immune system, right? So you will not be having any sort of capacity to fight against a small infection also. It's like if you just develop a small cold, right, it will turn out to be a pneumonia. If you just develop, or if you just start getting a small cough, it will start developing into a tuberculosis. It's just that you will be not having a strength to fight against small infection also, because the HIV is mainly targeting on your immune system, the cells of the immune system. Okay, and thus it will completely weaken the human being, and utterly he will die with a lot many diseases. Okay, so now let us discuss about the spread of diseases, like how this AIDS will be transmitted from one person to another person. Okay, so here I have written, right, few ways. That one is because of unprotected sex, which means that if a person is not using condom, right, during a sexual intercourse, then also there is a chance of getting AIDS from an infected person, correct? And then contaminated syringes and needles. Okay, if in order to administer any drugs or vaccines, if they are using contaminated syringes or needles, which means that the syringes which have been used in order to prick an infected person, and the same needle or a syringe, if they are using to treat, or if they are using to inject the healthy person, then also there is a chance of getting this AIDS. Okay, and then because of usage of contaminated razors for the purpose of shaving, like if an infected person would have been used the razor for the purpose of shaving, and the same razor if another person will use, then also he will be for sure he will get this AIDS, right? And then the transfusion of infected blood or the blood products. So this is also very important, one means of transfusion, one means of the transfer of this HIV virus from an infected person to a healthy person, right? So what happens when the infected blood gets transfused to a healthy person? for sure he'll get this AIDS, right? So that's why it is now made mandatory to have all these HIV negative blood report before a person donates blood to a healthy person. Okay, so that his report should have negative, which means HIV virus should come negative, then only he is allowed to donate a blood to a healthy person. Okay, so these are all the spread or a mode of transfer of the diseases from an infected person to a healthy person. See, because till date there is no proper vaccine for this HIV virus. Correct. So that's why the management of STDs and AIDS have initiated some preventive measures in order to prevent the STDs as well as AIDS. So now let us discuss what are all those preventive measures. So you can see that educating people in high risk groups can be taken as one preventive measures, and then screening test for the blood donors, just now I told, right? So now it is made mandatory to have a blood test, okay, before donating a blood to a healthy person. Only if it comes HIV as a negative, then only they are allowed to donate their blood. Okay, and next is mutually faithful monogamous relationship, which means one should have a very truthful and faithful relationship with only one person. Okay, so that a multiple partner sex can be avoided, which is also a preventive measure for this AIDS, right? And also if you avoid a prostitution and a homosexuality, so that also it is a preventive measure for the AIDS. Okay, so December 1st, actually December 1st is celebrated as a World's AIDS Day in order to create awareness among people in a public regarding these AIDS. Okay, so that's all about these STDs, which are nothing but a sexually transmitted diseases, right? Hope you understood this topic of reproductive health, why it is important. We got to know different family planning methods, right? Also about different STDs, how they are spread, like how it is important to follow these preventive measures, right? So hope you understood this concept and this chapter. Okay, so please like, share and subscribe to the channel, and do not forget to click on the bell icon. Also the links related to the same chapters, which means that the links of the different parts have been put in the description box. Please go through that and you'll get a clear idea of the whole chapter. So let's meet with the another new topic. Thanks for watching. Jai Hind.